Hi, my name is Mark Galloway. I'm an orthopedic surgeon here at Cincinnati Sports Medicine. I'm a team physician for the Princeton High School, Mason High School, and for the Cincinnati Bengals. And as a high school team doc, as well as a father of a recently graduated high school athlete, I understand that parents really want their kids to be able to take advantage of their high school careers. It's a limited amount of time and kids only have so many games that they're going to be able to play. As a sports medicine physician, my goal is to get a kid back in the game and keep a kid in the game as long as it's safe for him. And to do that, what I need to be able to do is to make an accurate and early diagnosis anytime there's been an injury, so that we know exactly what kind of problem that kid is dealing with, and we're able to differentiate between the kinds of problems that will let a kid participate and play versus those which could lead to further damage if we let him back out on the field. Parents struggle all the time with when they need to have a child or have their child see a doctor after an injury. The mentality of sports in general is one where we want to push through pain, and we say no pain, no pain, no gain, and we want to tough it out, but sometimes that's not the smart thing to do. So what I want to do here is offer a few guidelines that parents can use as to when their child needs to see a doctor after a sports-related injury. And what I'd like to do is sort of divide that up versus or based on the part of the body that's injured. We'll start with the neck and back. Obviously, any pain, obviously back pain, neck pain, especially with contact sports, is a very common problem. And what you have to differentiate from is soreness and sort of aching pain, which is usually muscular, associated with a little stiffness, from that which can be more serious, such as a bony sort of related injuries. And the most common thing we typically see in the neck is that we see sprains, and the most common thing we see in the back that we worry about are stress fractures. So the guidelines for neck and back injuries is if you have any numbness or any tingling either in the upper extremities from your neck or down your legs from your back, that's something that could represent more significant injuries such as a disc problem or potentially even a ligament problem where there's some nerves that are being compressed. So that's the type of thing where you want to have your child evaluated by a doctor. The other thing is really sharp stabbing pain, which not just stiffness that's associated with a little tightness, but sharp pain in which the person's really locked up and they have very poor movement. Difficult for them to bend their neck, difficult for them to turn their head with regard to their neck problems, difficult for them to bend over with regard to the back. These are the types of things that your child should see a physician for to make sure that's not a more serious underlying type of an issue. When we talk about the upper extremities, obviously dislocations, we can have sprains, we can have tendon injuries, we can have fractures. There are all sorts of things, and sometimes, especially in the wrist, a fracture may not be as painful as you might think it would. And sometimes you can have some very serious fractures in the wrist that are very sore, but there's no associated deformity, and it's the kind of thing that you'd really surprise that there's a fracture when you get the x-ray. So the guidelines for the upper extremity is if, one, you have limited range of motion, either the shoulder, the elbow, the wrist, the fingers, where you don't have full range of motion, person can't move their arm to the same extent that they can on the other side. That could signify a ligament injury, it could signify an occult fracture. That's the kind of thing that you want to have your child seen for. The other thing that you look for is a significant swelling, and swelling that happens very rapidly. Typically, if you get swelling that occurs just over a few minutes and looks like there's an egg deformity that's developing in the area of tenderness, you have to worry about there being a fracture there. So that's another instance where you want to have your child seen and you need to have x-rays taken. The numbness and tingling we talked about before, that could signify nerve injury, nerve damage. Those are the things you want to have a child seen for. Also, if you have lingering pain, if you have soreness that may not be that really sharp stabbing pain, still may have pretty good range of motion, but it just doesn't go away after 2 days, 3 days, that's the kind of thing that you want to get checked out, because again, you can never be certain that you're not dealing with a more serious problem that your child's going to aggravate if they go out and they play. Typically, if you have muscle strains and bruises, they typically get better over the first couple of days. So I would say anything that's lasting more than 48 hours where there's not been any significant improvement, you want to have that checked out. With the lower extremities, especially in the knee, if a child heard a pop or a snap, if there's immediate swelling, if there's limited motion, if there's difficulty with the child walking, if the kid is limping, those are the kind of things that can represent significant soft tissue injury to the knee, such as an ACL tear, such as a torn collateral ligament, or a potentially torn meniscus. Ankle sprains are very, very common, and one of the rules that we use as to whether or not there's concern about a fracture when someone has an ankle sprain is how well they can walk with it. Typically, if you have a fractured ankle, you can't take more than a couple of steps on it before you're having a lot of pain. So if your child's walking normally, they probably don't have a broken ankle. If they can't really put weight on it, that's the type of thing that you want to protect them with, get x-rays done to make sure they don't have a fracture. Ankle sprains can be deceptive. They're, again, a very common problem, especially in the winter sports where guys are playing jumping sports. They're coming down on someone else's foot and they roll their ankle. And with an ankle sprain, you damage the ligaments and you have soreness. The child can typically walk on the leg, and even if you tape them up real good, they can play with it as well. But the problem with an ankle sprain is that if you don't get it addressed and if you don't assess what's going on and you get them into some rehab, and it doesn't need to be a long structured rehab program with physical therapy, but just get them on, have them seen once and get them on some home exercises. A simple ankle sprain can turn into a more chronic problem where a person develops recurrent injuries. Every time you sprain your ankle, you stretch the muscles a little, they get weaker, and that weakness doesn't resolve with just playing sports and just doing day-to-day types of activities. You have to do selected, specified exercises to build up those muscles, and that's what prevents the child from having additional ankle sprains. And we see kids over and over again who have rolled their ankles over and over and over, and each time they roll it, it gets easier for them to roll it the next time, and by the time you see them, they've done it so many times that they have chips, they've stretched the ligaments out, and it turns into a bigger problem, whereas if they had addressed it immediately, gotten a little therapy for it, done their exercises either at school with their trainers, where so many of the kids here in Cincinnati have access, you know, they could have avoided the problem. So I hope these guidelines have been helpful for you, and hopefully you don't have to use them, and I wish you all the best in your high school athletic careers.